I really only have one objective in the course of the next 15, 20 minutes, and that's really to provide a framework into which to plan your expansion of the Cancer Centre's research mandate in the context of what we're doing at the school and how this will fit on that front. I think it's fairly reasonable to say that what we've spent the last year doing is trying to get outside of the box and think a little bit larger in what we can do as a school, but then doing it on an evidence-based background. So really asking the questions about what do we have the capacity to do. That's really led over the course of a year with a lot of participation from across the board in a new vision statement. Our destination is where we want to be in a 10-year time window. So this isn't a 5-year, this is something we're aiming for at the end of a decade. And that really is that for Schulich to be a global leader in optimizing health across the life course through innovations in research, education, and in actively engaging within our community. And I think that has pieces to it that I'm going to go through in a moment that you'll see you can pretty much hang on to. It has been built on a foundation of 4 different activities. There's no sense having a strategic plan or a destination and not having the resources to actually make it work. And then also, what is it that's realistic that we could actually do? So there's no sense in having a plan that goes out there that looks great, and then you don't have a snowball's chance of actually making it work over time. So many of you participated in the Research Task Force report, and I'll talk about that in a moment. We have to do some organizational realignment if we're going to see anything, and that's going to impact on what you'd like to see. Our strategic plan I'll address in a moment. And this is an interesting group of reports that we asked for that actually places where we as Schulich are in the context of our competition. Are we blowing smoke, saying what we can do? If we are, where do we need to fix that? If we have areas of strength, how are we going to deal with that? And really it does come down to being competitive. At the end of it, if we're actually going to change our strategy of the school or move it forward, we really have to do some coincidental changes in supporting infrastructure. So these are the things I'm going to spend a few minutes talking about, and I think you'll see, hopefully, how they all link together. Now, in terms of what we're trying to do on the strategic plan, a very quick overview, and this plan will actually be on the website, I think, within the week. The final little bits and pieces are done and all ready to go. It really does challenge us as a community to leverage the strengths that we have, to do a better job of integrating and coordinating our capabilities across the organization, and then to become more actively engaged in its community. And I think from what I was hearing from Brian's presentation this morning, that's pretty much bang on for what we as a school want to be seeing done. It really does reinforce the importance of research and innovation in healthy development and aging across the lifespan from preconception to end of life. And that might sound like a little bit of a motherhood statement that virtually any school could come forward with, but the reality is not any school can come forward with that. We have capacities in our epigenetics programs and our developmental biology programs through to aging biology and all the infrastructure and research that underlies that, that allows us to actually look at how can we integrate that in very specific themes where we'll be much stronger for that. We do have to really work on the concept of translation across all of our research domains, and how do we exchange that knowledge, not only with practitioners and researchers, but building it into our curriculum. I think what I just heard from Tom is fascinating, but how are you going to teach that to a group of students when it's evolving that quickly? And once they're outside our door, how do we ensure that they have the capacity to know how to use that information in their clinical practices or in their research careers or wherever they might be going after they've finished with us as their educators? And I think that's the domain we need to be thinking about. How do we strengthen that? I could probably spend a half an hour talking on this slide alone, because this really is the whole enchilada summarized in one fell swoop. So the idea of our vision here being 10 years, as I've mentioned earlier, is something that we can set as a stretch goal, but that's where we intend to be with that. And in the document, as you look through this on the web, you will see that there are 1, 5, and 10-year deliverables that go along with each one of these points. You will see the metrics by which you can actually determine have we achieved those. And you can ask us, did you achieve them? Why didn't you? What did you miss on this point? And we should have an answer to that. Within our strategic leadership committee that will be seeing this going forward, each member of that team has 1 or more objectives assigned to them. So this is not something that's just going to happen passively. People have a responsibility for ensuring that this project goes to fruition, much like you'd run something in a lab for. So it's pretty straightforward. It does build on 3 key areas, so knowledge creation, knowledge translation, and exceptional education and learning. And we really we've talked a little bit, I commented briefly about the science of healthy aging. The translational component, in order to have that, we need to position ourselves with the capacity to ask these questions. Are we making a change in healthcare outcomes? And is there policy and economics that can drive those decisions? And frankly, when you look at the size of the patient population that we deal with in southwestern Ontario, there's no reason why we are not a go-to organization for asking questions about those types of impacts or the development of policy around a disease management. So to do that, we're going to have to build some strengths in there. That is going to be built on the back of an interfaculty program in public health and public health policy. And that program is getting developed as we speak. And our first enrollment into a school of public health will be in September of 2013. A new facility is being built for that. So if you're driving down Richmond and you happen to pass Windermere, and on your right-hand side is the Westminster College. If you look at the baseball diamond that's still there, it will still be there. But in front of it, you'll see a bunch of red stakes in the ground. Those are our stakes. Okay, so that will be a new building that's going in to house an awful lot of this work. Things that I think will bring resources to the city that will be helpful for that. Engage partnerships. Academia, community, and industry. We have to get better at doing that. Cancer probably leads that, along with our imaging folks, more so than any other aspect I've seen on our research side of the equation in understanding that relationship, and we have to do that. And then there's a series of enabling strategies that we can talk about in questions later. And there are key areas that we need to excel on that. But if you wanted to distill that even further, these are the three pillars on which we will be developing virtually everything that we do over the course of the next decade. So that is in the creation of knowledge, translating it, and putting it into our education curriculum, and then feeding back to that. This has to be a continuum. You can't pull one piece out and say it's not going to affect the others. So that is the concept that we will be after. It's built on 6 strategic initiatives. So those 3 key pieces don't have 150 pieces behind them. They actually have 6, and each one of those has a number of deliverables which number no more than 20 for the next 18 months for us to achieve, and they're all achievable. So we'll have to work on creating the knowledge of science and healthy and successful development across the aging lifespan, strengthen knowledge translation, become a destination of choice for exceptional education and learning. Right? That sounds pretty straightforward. We are actually there in many of our areas. You may not be aware that we are the demand site now for the BMSC program. It is the #1 program in Canada. We are oversubscribed to that. Our medical students coming into the program have the highest MCAT scores and GPAs of any students across the country for that. When they graduate, they're the #1 in the LMCCs. When you look at our dental students, they're the #1 on their GMAT scores coming in. So when you look at all of these things, we are getting the students here. How do we translate that into better graduate students and postdoctoral fellows and feed into that pipeline? We have to be a center for demand for that as well. The sustainable partnerships and global networks we've heard a little bit about. We have to really foster programs for the growth and success of our faculty. We don't do that well. We are not a destination of choice on any aspect of it for thinking about your career moving forward, particularly if you're within the administrative realm here. It's not seen as a movement forward friendly type of organization. And we have to get our story out better. You know, when you look at the number of things that we have success in, and have we actually gotten the story out there, the answer is no. And we have to start to move that forward. This will also be built on a background of implementing the research white paper. So this was a task force that many of you participated in. We've already started implementing many of these, but for those of you who aren't aware of this, this will also be on the website for it. The Vice Dean Research, we're in the process now of finishing that up. Reorganizing the research office into additional positions, which we're phasing in over the course of 3 years. When you look competitively and ask, you know, why are we where we are on a research front? Is there an infrastructure that we can point to? We can't. We have a very slim infrastructure, to be generous for that. But when we look at our competitors like University of Alberta or Calgary or McGill or others, we are a fraction of the support from writers, grants facilitators, people who can focus on themes. So there's a plan to bring 15 to 18 new people into the organization to help directly to make our lives easier as researchers in getting some of these large proposals and such together. We really have to recreate this culture of research. I think that's pretty much why I signed on the dotted line a year and a half ago, is that I felt that we have the capacity as a school and as an academic community to refocus ourselves as a core research organization for that. All of our trainees, regardless of their educational program, need to have exposure to research and to be thinking about it. Even if they'll never do it, they need to understand the concepts that lead to experimental design, analysis, and translation with that. This issue of a core of highly performing multidisciplinary centers or groups to get international recognition, I'm going to come back to in a moment, because that's a cornerstone of it all. Additional research resources. We'll deal with the cage charges. We've already got a group helping us on that. And I think you'll be happy with what we're going to be able to achieve there. Gap competition is going to be critical, right? 15K, 20K doesn't help you if you're going to be out of the game for a year while you're retooling a grant as you got your 4.41 and that didn't get funded. And that's the nature of the beast. We also have to think about how do we help enable those grants to be more competitive next time they come through. So this will be a much more substantive resource to help you with. The 2, 3, and 4 is pretty much self-explanatory. Getting our young and up-and-coming clinical research faculty going is going to be critical to us. We can do everything we want on the basic sciences side and driving all of that. If we don't have a cadre of clinicians who are dedicated towards implementing that or providing information back to us, we're blowing smoke. So we need to refocus on that, and we've lost a bit of that focus over the course of the last while for that. This issue of inventory of research interests and skills necessary for our team input. This is a pet peeve of mine in life, that every time you want to start a new project and you want to think a little bit outside the box, I got to start all over again, finding out who might actually have a skill set, whose door I might knock on there. That should be a central thing that we all can easily access and can be coordinated rapidly. So how do we actually get away with doing all of this? Well, first off, we got to deal with some perceptions. We have some problems, and this is the level 5 report. This is a report that was commissioned by us, by a group out of Toronto, to actually ask the questions about, as a school, where do we stand relative to our competitors? And I wasn't particularly interested in calling up mom and saying, gee, was it a great school? I was interested in grants, impact, SGI index, how many committees are we sitting on? When we're doing research, is it impacting on the change or flavor of research being done elsewhere? How many endowed chairs do we have? The list goes on, and I'd be happy to provide that with you. But concrete, hard metrics that we could go and compare another school to ours and ask, where are we in the course of all that? We did ask our students as well for their thoughts. So this is the report card that came through, and this is going to be tough to read, and I don't expect anybody to. But Schulich is sitting right up front here in the first, and basically this overall scorecard. If you're a black dot, you're doing extremely well. If you're a white dot, you have problems and you need to start focusing on things. And when we look at our two main competitors, McMaster and Alberta, even from the back of the room, you'll see that the vast majority of their columns are filled up with black dots, in which they've managed to nail it. And we are the majority either white dots or little black ones with a white hole in the center of it, suggesting that we have a lot of areas where we can move forward, even to be competitive with our groups. Now, if you distilled that down, where's the problem? Okay, so there are opportunities. It wasn't a dismal report after about the 4th reading and a little bit of scotch. It actually got better. Okay, more than a little scotch. We have opportunities where we can move forward as a school. So the competitive set for us is average to weak across most of the metrics that we looked at. But then if you dissect that out, who are the top of the pack? Well, we've got U of T, McGill as the clear leaders in Canada. Well, intuitively you would have said that, right? And same thing, UBC is just on the cusp of joining them. Actually, you'd be a little disappointed if they weren't. With all the resources and the faculty and everything else that's going into that, that's where you expect them to be. So if we're going to come forward and say we're going to be one of the top 3 in Canada in our overall, really? We have to start thinking about being much more strategic in doing that. But if we look at the next tier for that, University of Alberta and McMaster are in the second group and distinctly weaker than U of T, McGill, and UBC. And we're sort of sitting right on the edge of them in joining that group, which is a pretty hard reality to look at. And then everything after that is after that. And so the question is, where's our weaknesses? Where can we actually move forward? Well, perhaps not surprisingly, our specific area of weakness is in research and third-party rankings. Well, third-party rankings are largely based on our research productivity and our citations. So again, those are inherently congruent to look at. And for instance, 32% of the Maclean's rating is related to research. And you might say, well, gee, that's great. Who really cares about the Maclean's? Well, our postdocs do, and our graduate students do, and our undergraduate students do. They look at those sorts of data, and they say, where am I even going to think about going? And then they don't write and ask for a manual or a flyer, they go to the website. And if they go to the website, they want to look quickly and find out what's the information that underlies our skill sets and what are we actually doing. And if they don't get it, they flip to the next website. Okay? Or they might go to Tweeter or whatever the heck it is they're using nowadays, right? Okay? And they'll get that information there. And it turns out that our students are our best salespersons. We are at the top of the pack for our students saying that this is a phenomenal experience. Okay? So there's an offset in there, and that's why we get these students coming here. Once we get them there, we need to run with them for that. This chart is sort of a summary chart, but there's two pieces that I want to highlight on that. Okay, so there's a series of takeaways from the report, but there's some implications to Schulich. And when we go through all of that, one is that we have an opportunity to focus on a few key research areas that we can own and create an aligned message about. So these are areas that we can actually say we're strategically strong in. And when we put out a report that says that we have 7 core areas of research excellence and 9 that are developing, my math is that's 16. Do we really have 16 areas in which we can claim to be a national or a global leader in research and prove it? Well, the report just turned around and said, you're not. You can't prove it, and you need to be careful on that front. So they're saying, focus, get onto that. We have an opportunity to redefine our vision in terms of the student experience and research areas that we already own. So let's move forward on all of that. And when it comes down to sort of the bottom, a few specific areas of research it's already a leader in with proof points to support this. It means focusing. Right? We can't say we're good at 16 things anymore. We can be building 16 things. We can build 100 for all I care. That's wonderful. We're a university. We should be doing that. But let's get out in front of the pack and say what we're good at, resource it appropriately, and get to the point where we can say we're a global leader in that. So how are we going to do that? Right? There's some supporting structure that we're going to have to build. And we have a problem in our school. Okay? This is like putting your laundry out there, but I'm not putting it out if we don't have solutions for it. We also looked, and we had Deloitte come in, right, and do a review of us as a faculty. So this has been going on behind the scenes with an awful lot of participation from your AOs and leadership groups and such, to ask the questions, with that strategic plan in mind, do you actually have the capacity to do it? Right, the two have to be linked. And so what Deloitte came back with, a very hard-hitting, this was the second little bit of scotch, was to say, we need to do a lot of things. We have to reorganize ourselves in order to integrate across a broad range, to do better delivery of excellence at a distance, and also have to understand better doing processes, communications, project and team methods. And why is that so important? We have to end something that I've seen for 20 years, something I was skilled at, because this is how we worked at it, right? You have to get an end to siloed management, inefficient decision processes, and hierarchical decision making and key person dependencies. And what that is saying is that all of us as chair chiefs or program directors got extremely good at figuring out how to get to A to Z and skip everything in between, because everything in between took you forever to get through. So we did workarounds, right? The problem is that if you're the person housing Z, like a research office, and everybody's working around to get to you, you're going to implode. Nothing gets done. Nothing's efficient. Nothing is fast. We have to improve on that. If you figure out that workaround, it's dependent on 1 or 2 people. God help us if they leave, because now you got to start all over again and build those. So we need to clean that up. And in order to do that, we actually have to start looking at organizational structures where we have functional management that's better. We have to look at effective processes. So if you want to do a hire quickly, it's not a 6-month turnaround. It's a 1-week turnaround, and it's done paperlessly. Okay? We need to get to that level of organization here. Team-based decision making, skill-based training for career opportunities. How do we move people forward with all of that? This is an example of how we exist in just one piece of the organization. And you got to ask, no wonder we can't get through it quickly. There's skilled people. This is not a person issue. This is a, how do we actually make the organization work? How, for a researcher, can we make it more efficient? There are 11 principles that you'll see coming up with all of this. The bottom line is that looking at things in a manner in which you would want them to run efficiently, cleanly, so that we can enhance research productivity, getting the message out there, and allow you as investigators, myself as an investigator, to spend less time trying to figure a system out and more time doing what we actually trained to do in the first place. And if I had to put it all together, that would be what we're trying to attain. So how do we move this whole thing forward? Pretty easy. Sounds easy. We have to do this infrastructure renewal. We're well on our way with that. This will create a whole panacea of tools that we'll be able to use, but really just our research, education, globalization, and public health domains. And when we start to tie those in together in discrete areas where we can do it, there's no reason we cannot be global leaders, but it won't be in everything that we do. And we're just going to have to accept that. So the final things, the final slide, what is it that we really need to be doing? Well, we're going to implement this strategic plan. A lot of work went into it. They're not meant to sit there on a desk and do nothing. Flip side is, it may not look the same in 5 years' time. If we're not constantly iterating, as we would teach our students to do, then we're really not doing anything. So it may look a little different as we go along. At least this gets us started on that pathway. The research white paper we're moving along nicely on as well. That gets us started there as well. We have to define our core area of strengths, and I would really challenge this group as to where do you fit on that platform. And I think what I've heard already today would be that's a pretty easy sell. We have to look at our brand to focus on our strengths and our student experience, do better at communications, and we really have to get on with restructuring the organization. And that's going to be a 2 to 2.5 year process, which hopefully you'll see only the benefits of, not all the pieces underlying it. So that's a little bit of an overview of where we're going with the school.